For someone with rheumatic fever, the risk of developing mitral stenosis in the future is totally different from the probability that a patient with an already stenosed mitral valve has suffered from rheumatic fever in the past. However, the odds is the same. We always have two different risks and the single odds. Each risk describes the effect of one variable on the other and not the reverse. But the single odds expresses the tightness of the relation between both variables regardless of the direction of the study. In consequence, the relative risk can indicate causality and is the outcome of choice in randomized clinical trials, while the odds ratio fits better observational studies and logistic regression. Another point, some of us may confuse the risk and the hazard. Let us take another example to show the difference. If the outcome of a particular study is cure and patients were followed up for 5 years, a relative risk of 2 means that after 5 years, twice as many of patients in the treatment group are expected to be cured compared to the control group. The relative risk is cumulative. Final calculation will only be made at the end of the follow-up period after 5 years, making it perfect for clinical trials as noted. On the other hand, a hazard ratio of 2 means that any time during those 5 years, twice as many of patients in the treatment group are expected to be cured compared to the control. The hazard ratio is instantaneous. Results are supposed to be valid any time during those 5 years, which is why it is the outcome of choice in time to event analysis.